As we head towards the Easter weekend, in the third week of lockdown, is it really only 3 weeks? I wanted to update you on what has been happening recently and look at some of the issues coming up as we move forward together as a profession. Firstly, what a tremendous response from osteopaths to the call to support our NHS. As we reported earlier this week, around a quarter of the whole UK profession has stepped up to this call. In England, over 1,000 osteopaths have volunteered, joining the several tens of thousands of retired and former NHS clinicians. We are also aware that lots of others have been approaching local GP practices and community providers directly, so the total number of us stepping up will be higher. The IO has also been talking to the health services in Scotland, Wales and Northern Ireland, and I am delighted to report a positive response so far from the Scottish and Welsh health services. Health Education England is currently tackling the mammoth job of rapidly building workforce capacity into the NHS and starting to place the many thousands of health professionals in roles all over the country. Last week they asked us to contribute to the draft of a guidance document which sets out the many roles that osteopaths will be playing throughout the whole patient journey, working as part of multidisciplinary teams. This week, this guidance has now gone live to trusts and commissioners. I need to stress, however, that the skills and roles that we may be called up to fill will be determined by need, less likely in critical care, but as part of what will be a long recovery support phase. What has also been clearly expressed by HEE is that while we are asked to help meet an immediate need, that this is an opportunity for osteopaths to establish themselves and bring our unique viewpoint into the multidisciplinary working environment of the NHS longer term. I have been keeping GIOSC informed of these discussions, and they have been supportive of our position and to the need to be flexible and responsive to scenarios that may see osteopaths working in new settings. This is a huge endorsement of the profession and a key acknowledgement of the skills that we have to offer. I do need to stress that these call-ups will take time to implement due to the sheer scale of mobilisation. HEE has made it clear from the outset that existing NHS staff, which includes osteopaths already working in the NHS, will be phased in first. The next phase, in which other health professionals will be deployed, will be forthcoming in the weeks after. I have a huge ask, by the way, to the 1,250 osteopaths who have answered the NHS call. Can you please let us know when you get accepted, and please stay in touch about what you experience. We will all benefit from learning what you will be learning. And also to those who have not yet signed up, including those who are about to graduate and join the register, the NHS continues to need you. In other news, we have been dealing with some of the loopholes in the government support packages announced over the last 2 weeks, and we've been busily lobbying to get these inequalities addressed. We are also very pleased that we will be able to help over 500 members who have applied for deferral on membership fees. And actually, I also want to thank the many members who've written in to say they will not need to take this up so that we can continue to provide support for all members. At present, around 2/3 of practices have now closed, over a quarter provide telehealth consultations, and just under 10% continue to provide urgent and emergency face-to-face care. We are also, of course, looking forward to what we need to do to support members and the profession during the next phases of this evolving situation. This includes, for example, how we can best support practices reopening, identifying potential suppliers of PPE, what a patient information campaign could look like, how we can work with our schools to maximise student intake, and of course, how to stay engaged with the ongoing NHS plans to restore the nation's health. No definite solutions yet, but we are working on all of these. We still have weeks of uncertainty ahead of us, but what I hope you will take away is that we are committed to guiding the profession through this. I know that if we keep together and work together, we will emerge stronger for it. In the meantime, have a good Easter. Stay safe, stay well. Happy Easter.